Hi, everybody. Today we're going to be talking about PAWS or post-acute withdrawal syndrome. PAWS affects people who have engaged in any sort of addictive behavior, not just substances, but it is definitely more prominent in people who have abused chemical substances. The effects are based on a variety of factors, including somebody's age. People who are younger tend to have more pronounced brain changes as a result of engaging in addictive behaviors than people who are over the age of 26. People who are elderly also have different ways of metabolizing substances and may experience a difference in the rate that their body recovers from addictive behaviors. People's gender also affects their recovery rate and their PAWS symptoms. The length of time that you used and how much you used also impacts your recovery process. If you only used for a short period of time and you didn't use very heavily, your post-acute withdrawal syndrome is probably going to be a lot milder than somebody who was using for an extended period and used pretty heavily. And finally, your physical health. If you are overall pretty healthy, then you're probably going to recover a lot faster than if you are nutritionally deficient and have underlying physical health conditions. It doesn't mean that you won't recover. It just means that if you are dealing with other issues, it may take longer for your body to completely recover, and you may experience post-acute withdrawal syndrome symptoms for a slightly longer period of time. PAWS begins after acute withdrawal, after that first 1 to 2 weeks, and usually lasts for up to a year. When somebody is experiencing post-acute withdrawal syndrome, they may experience emotional outbursts or just a lack of emotion. They may feel kind of flat. They may experience anxiety and irritability, or on the opposite side, depression or just lack of any sort of feeling, anhedonia. Nothing brings them pleasure. They may have difficulty dealing with stress and get overwhelmed easily. They may have low energy. They may have a hard time sleeping, strange dreams, or changes in sleep patterns where they sleep for a while, then they wake up and they're awake for a while, then they want to go back to bed. There's a lot of different things that happen. They may have memory problems that make it hard to learn new things during this period. Doesn't mean it'll go on forever. They may have trouble thinking clearly, making decisions, and solving problems. They may experience dizziness, problems with balance, and delayed reflexes. Those are your main symptoms. Now, a lot of these have to do with the fact that our brain chemicals, norepinephrine, dopamine, serotonin, and GABA, tend to be out of alignment, tend to be out of balance during this early recovery period because our brain has experienced actual changes and actual physical injury as a result of the addictive behavior. Just like when you get a bruise on your arm or you break your arm or something, it takes a while for your body and brain to repair it. Well, it's going to take a while for your body and brain to repair any damage that was done when you were engaging in the addictive behaviors. Be patient with your body, be patient with yourself, recognize these symptoms, be aware that they are probably going to occur for you at some time or another, and develop a plan so you are prepared to deal with them when they happen. Just like you have a plan for how to deal with a cold when you have it, you need a plan for how to deal with post-acute withdrawal symptoms. Think about what are the causes of each of these symptoms for you. So go through each symptom and identify some things that cause that symptom for you. Then go through each symptom and identify what are the effects of each of these symptoms on you and your recovery. So if you are having the symptom of emotional outbursts, how does that impact you and your recovery? Well, I tend to, if I'm having a bad day and I have an emotional outburst, I tend to feel guilty and ashamed that I was irritable with somebody. So that's how it affects me. It has a negative effect on me. And how does it affect your recovery? Is this symptom going to trigger unpleasant feelings that might trigger a relapse? Is this symptom going to keep you from engaging in the behaviors that you need to do, like going to meetings or calling your sponsor, that are essential for your recovery? And what are 2 ways that you can deal with each of these symptoms? You may not have them right now, but let's just plan in case you get them. What are 2 ways that you can deal with them? And if you're doing this as part of a group, share, develop, brainstorm a list that each person can pick and choose from in order to identify at least 2 ways to deal with each symptom of post-acute withdrawal syndrome. Final thoughts. Recovery involves creating a new life where it's easier to not use, and that takes some time. You need to be completely honest with yourself and others about how you're feeling physically, emotionally, and what your thoughts are, what your needs are. It's important to be willing to ask for help. We as humans were not designed to do everything in isolation. Asking for help does not mean you are weak. Learning how to ask for help is going to be important in your recovery. Practice self-care, making a daily routine that allows for time to rest and relax. A lot of people, especially in early recovery, they're looking back and seeing all the things that they, quote, should have done, and they feel guilty for taking time to rest and relax in recovery. But it is so important to do this. It's important to take time to allow your body to recharge. Just like you allow your phone to recharge, you need to allow your body to recharge each day. Create and maintain your recovery boundaries. What you are willing to do, what you can expose yourself to. You will have some soft boundaries and you will have some hard limits. This is not okay in my recovery, and it's important to know what those boundaries are and learn how to assertively communicate and maintain them. Identify and stay in touch with your support system. It may be family, friends, counselors, healthcare providers, spiritual leaders, a religious group. The list goes on. Whoever is in your support system, identify who they are and make an effort. You have to make an effort to actually reach out and stay in touch with them on a daily or weekly basis, preferably daily in early recovery. We need all the support we can get during this early recovery period. And finally, be compassionate. Treat yourself with patience and understanding, giving yourself time to heal. Just because somebody that you started the treatment program with may be further along in the recovery process than you are, don't beat yourself up over that. We all recover at our own rates, and it's important to be compassionate with yourself, because if you start beating yourself up, you're going to have your body dumping those negative emotions again, dumping those stress chemicals again, and you're going to set yourself further back. So be compassionate, take it slow, and remember that you can do this.